this video we will see the anatomy of kidney. So kidneys are located on both the sides of our body, that is right and the left. And suppose this is the right kidney, so it is located in the epigastric, the right hypochondric, the umbilical and the left lumbar region, right lumbar region. And so this is the left kidney, so it is occupying the epigastric, the left hypochondric, the umbilical and the left lumbar regions. So now we discuss their anatomical features. This is the anterior surface of the kidney and this is the posterior surface of kidney. Posterior surface of kidneys are almost flat and the anterior surface of kidney is convex. Now the borders, this is the lateral border which is convex, this is the medial border which is concave, and it is having a depressed area over here. This depressed area is known as hilum of kidney. Then there are two poles in the kidney. This is the lower pole which is pointed and this is the upper pole which is occupied by the suprarenal gland. So this is the portion of the suprarenal gland in the right kidney. Now the size of the kidney, it is having 11 centimeters length, 6 centimeter width and 3 centimeter thickness. The normal weight of the kidney is 150 grams in case of males and 135 grams in case of females. Now we determine the side of kidney, as we have two kidneys. So these can be determined with the help of the structures at the hilum. So at the hilum, the anteriormost structure is the renal vein. So this can be identified by its larger diameter and thin wall. So this is the renal vein. Behind it we have the renal artery. These are the renal arteries. Then this is the pelvis of ureter. This is directed downwards. So anteriormost structure is from renal vein, then artery, then pelvis of ureter. So this is the right sided kidney. Similarly, in the case of left side, the anteriormost structure is the renal vein. So this one is the renal vein, and behind it we have this renal artery. This is the renal artery, and the posteriormost structure is the pelvis of ureter, which is directed downwards. So from anterior to posterior side, the structures are renal vein, then artery, then pelvis of ureter. So this is the left sided kidney. So in this way we can determine the side of the kidney, which is usually asked in your spotting. Then we come to the relations of the kidney. So first, the anterior relation. On the anterior side, in case of right sided kidney, the topmost structure is, which is located on the upper pole of the kidney, this is the suprarenal gland. So this is the right suprarenal gland. Then beneath it we have the impression for the liver. This is the area which is related to the liver. Then medially close to the hilum, this area is related to the duodenum, the second part of the duodenum. Then this lateral part is related to the colic. Then this lower part is related to the coils of jejunum. Then in the case of left side, the uppermost structure which is located at the upper pole of the kidney, this is the left suprarenal gland. Then this triangular area is related to the stomach. Then lateral part, it is related to the spleen. Then beneath it we have the relation with pancreas. Then this lateral part close to the lower end, this area is related to the colon, and this medial part is related to the jejunum. So these are the anterior relations of the right and the left kidneys. Then the posterior relations are common. On posterior side, if this is the right sided kidney, it is related to only the 12th rib, and the uppermost area is related to the crus of the diaphragm, that is the domes of the diaphragm. Then below it, the medialmost structure is the psoas major muscle. Then lateral to it, there is a relation of quadratus lumborum. Then the lateralmost structure, that is the transversus abdominis muscle. And between these muscles we have emergence of the subcostal nerves and vessels, iliohypogastric, and then the lowermost is ilioinguinal nerve. Then the posterior relations of the left kidney, these are similar to the right kidney, except the upper part is related to the left crus and the left dome of the diaphragm, and it is also related to one more extra rib, that is 11th as well as 12th rib. 11th rib lies above and 12th is lying below, and the remaining muscles are same. Then we come to the interior of kidney. So this is the interior of kidney. Here we can see the interior of kidney is divided into two parts. the outer part, this is the cortex, and this inner part, this is known as the medulla. In the medulla we can see this triangular area. This triangular area is known as the renal pyramid. This renal pyramid, it is having a base which is facing towards the cortex, and the apex, which is known as renal papilla. This renal papilla is opening into this, the minor calyx. So this is the minor calyx. This renal pyramid, along with the area above it, that is the part of medulla above it, is known as renal lobule. This cortex is emerging between the two consecutive renal pyramids. So the area of the cortex which is evaginating into the medulla between the renal pyramid is known as columns of Bertini. Then we have this minor calyx. The fusion of 2 to 3 minor calyces forms the major calyx. So minor calyxes fuse to form the major calyx. Then we have 3 to 5 major calyces. These major calyces, here we can see these are the major calyces which are formed by the fusion of minor calyces. They unite to form the pelvis of ureter. So this part is known as pelvis of ureter, which is formed by the fusion of major calyces. The normal capacity of this pelvis of ureter is from 5 to 7 ml. This pelvis of ureter then further continues downwards to form the ureter proper. Then the renal sinus. Renal sinus is the area, the depressed area, which is containing the structures at the hilum of kidney, that is renal artery, renal vein, and pelvis of ureter. So these structures, these are lying in this area, which is a depressed area known as renal sinus. So this is about the interior of kidney. Now the blood supply of kidney. The kidney is supplied by the renal artery, which is arising from the abdominal aorta. The venous drainage is into the renal vein, which is draining into the inferior vena cava. The lymphatic drainage is into the lateral aortic group of lymph nodes. So this is about the kidneys. Thanks for watching.